A simple gesture of appreciation to the NHS from a grateful nation.
The NHS is one of the most beloved institutions in the modern history of the British Kingdom, but it was designed for a country that no longer exists.
Which will provide the best medical advice and treatment for everyone, every man, woman and child in this country.
For 3/4 of a century, the NHS has managed something that no other country's health system has managed at this scale. It's treated tens of millions of people, free at the point of use, year after year. If you have a heart attack tonight in London, an ambulance will come and collect you. If you have a stroke, an emergency team will try and save you. If you need chemotherapy for cancer, you will receive it without ever receiving a bill. At its core, the NHS is a revolutionary, incredible system. A real icon, actually, of post-war Britain. But there is one statistic that quietly undermines the entire story.
The message to the Prime Minister and his new Health Secretary, loud and clear.
And it points to something that almost every Briton can feel somewhat in 2026. That an institution that they grew up trusting and believing in is crumbling a little bit under its own weight. There's so many postulated reasons for this. A lack of funding, a lack of policy initiatives by the government. I've been doing some investigation to really understand the structural reasons why the NHS is struggling right now. And naturally, the first people who I spoke to were my parents, who have been NHS pharmacists for the last 30 years. And so they've understood firsthand how the NHS and the healthcare system in the UK has changed over the last 3 to 4 decades.
Glasses or no glasses? I think it's the best thing ever. It's the biggest thing ever. And to be honest, I am so proud of the NHS system. I mean, it's such a fantastic system. Where in the world does a system like this work?
On paper, the NHS is still the most generous healthcare system in the world. Free GP appointments, free hospital stays, free ambulances, free prescriptions in 3 of the 4 nations of the United Kingdom, national vaccination programs, national cancer screenings. But the truth is, the diseases that affected Britain in 1948 when the NHS was incorporated are not the same diseases that kill Britons in 2026. The NHS was built as a system for infections, surgeries, injuries, the kind of medicine where you get sick, you see a doctor, and either you recover or you don't. The people of the United Kingdom today live with different afflictions. Now diseases are slow, more behavioural, chronic, and those are the kind of afflictions that the healthcare system in this country is not equipped really to deal with.
We're all aiming for the same thing. All of the individual providers and stakeholders in the system all have the same agenda, and that is for our residents, clients, patients, whatever you call them, to live longer, happier, healthier, safer lives.
For more than 100 years, the average UK life expectancy rose almost every single year until around about 2011. And since 2011, the life expectancy has been basically stagnant. And in some regions, the life expectancy numbers have actually declined. So what actually happened? This era mismatch of diseases is just the foundation of what makes this a problem. On top of that, other things have been compounding for the last 15 years. To start with, the United Kingdom has an aging population. More people in Britain live into their 70s, their 80s and 90s than ever before. More older people means more chronic conditions, more medications, more constant monitoring of health. The healthcare burden compounds every year.
So life expectancy historically was always related to health. So we always looked through a health lens, but actually you're absolutely right. It's much wider than that. Focusing all of the resource and all of your energy on health isn't necessarily going to bring that life expectancy gap down as quickly as you'd like. So there are other interventions that we've done, alluding to what you've mentioned about changing the way resource has been deployed. And I'm very proud in Westminster that 10% of that R's budget, circa $500,000, we've deployed on a very new intervention, community health and wellbeing workers, called CHUIs. It's a Brazilian model, which is essentially people from the community working as employed people knocking on a number of doors every month and taking care back into people's homes. So this isn't a reactive healthcare service. It's a health and wellbeing service that's proactive and, dare I say, preventative.
The second thing is that the healthcare system in this country used to be supported by something that no longer exists, the domestic family unit. In 1950s, at that time the NHS did the acute care, and then the aftercare was done within the family unit. That structure is not as pervasive as it used to be. So partly the NHS is now asked to absorb this other aspect of healthcare that never initially was incorporated to do so. The third thing here is the workforce. Every year, the reality is clear. There's simply not enough doctors or nurses. And truth being told, the ones that we have in the United Kingdom are being burnt out. But when I actually delved into the reality of the situation, it was quite startling. The starting salary for a doctor in the UK is comparable to the starting salary for a doctor that's newly graduated in these other regions, in New Zealand, in Australia, in the United States also. But the problem is that in the UK, the salary progression isn't as steep with years of experience in the UK as it is elsewhere. So, in a perfectly competitive market, they get up and leave. The fourth aspect here is the funding. This is the very well publicised aspect of this argument. The truth of the matter is the United Kingdom and the UK economy has really had very little productivity growth since around 2008, the Great Recession. The GDP per capita has been comparatively flat for the last generation almost. The NHS started to dip at the same time as the UK economy started to slow, and that's not necessarily a coincidence. The fifth aspect is the pandemic. The COVID-19 pandemic didn't necessarily cause any structural damage, but it certainly exposed underlying fragilities. We remember at the beginning of the pandemic where people were in such appreciation of the NHS service, of the health service of this country, but I think over a period of time, it started to turn into some sort of resentment. And again, this was another factor that caused a lot of the medical professionals in this country to feel burnt out and unappreciated. Whatever was cracking under the surface at that period of time with the healthcare system simply started to break faster. And both sides, the patients and the people, feel abandoned.
I guess as people do that.
No, oh my gosh, the number of people have coming in and they've already consulted ChatGPT. I mean, Google's a thing of the past now.
Yeah.
But ChatGPT, and they've got their outcome. TikTok, I've had patients coming in.
Really?
TikTok's told me, X, Y, and Z.
But they follow certain people, or they follow like their For You page?
I think that I'm not very tech proficient, so it's not necessarily something. But yeah, I think it's more For You, and they may. They'll be asking either certain questions or putting in certain symptoms.
This is why partly I think we're seeing this movement of the longevity idea into the zeitgeist. Nowadays everywhere, especially since the pandemic, we're seeing longevity clinics, functional medicine, diagnostics with wearables, private healthcare solutions like Neko Health, for example. All of these are a symptom of preventative healthcare that suits the reality of modern Britain.
If you get HIV, if you contract HIV today and you contract diabetes today, the person with HIV will live longer. And that too is huge. So diabetes is a huge problem. So the more we can do to upstream, we've kind of created a RAG rating. So red, patient with severe diabetes under a specialist, about to need an amputation or has got severe complications from his diabetes. Amber, definitely got diabetes, being managed by their GP on one or two medications, and their numbers look good. Green, either just diagnosed or at high risk. What you're alluding to is the blue. So I call it a brag rating. I think this is me making this up. But the blue becomes, there's no one looking at you at blue. But if we can put some resource at blue, you will reduce the green, amber and the red. The red costs the system loads of money. The amber costs some money and the green is reasonable at the moment. But if you deploy lots of resource here, you can stop this or reduce it significantly. Now, this timeline isn't months or years. It's long. It's a really long time. It's a long play. It's sowing seeds for the future. So the problem we have is, whether it's politicians or health systems, we don't have that ability to have such a long-term vision of 15 years, say. I don't think any party will ever come in and make that dramatic change, whether you call it a subscription system or national insurance stamp system or a top-up system. I think free at the point of access is what we call it. The NHS will always be free at the point of access. I'm a big fan of the NHS. You know that I don't do private work out of choice. And I really want to try and keep the NHS the jewel of the crown in the UK and for the world to be, for it to be the envy of the world. I'm a realist equally, and I recognise that elements of it aren't working. You're right that if you're sick, ill right now, an ambulance will scoop you up, take you to hospital, you'll get sorted and you'll get treatment. And I would even say to those people, don't even go privately, because I don't think private can compete
I've heard,
with
much
that.
Better, right?
Yeah,
The NHS
right.
is
So,
better.
but I think some of the stuff where, you're waiting for a hip replacement for 9 months, a year, and you can't sleep at night, and it's impacting on your ability to play with your grandkids and all the rest of it, that's not a good look, right? So I see that. And then there's postcode lottery stuff. Certain areas can have certain things, IVF and other things. So it's a good question, and it will be interesting to see where it goes. And I think, like I say, it would be a brave political stance to reduce funding to the NHS or change it in the way its makeup is. But I think out of choice, out of choice, again, from your perspective, many more patients. I was on the tube today. There are more and more GP subscription packages. There was an advert that I was looking at even today, company that I hadn't heard of, and it's GP subscription. It's, for X pounds per month, you can have a silver, gold, platinum package, and within that you get 6 appointments per year, 1 proactive check and a blood test, and that's what it costs you. And I think people will start thinking about allocating, certain groups will think about allocating money in their own incomes towards their own healthcare. Whereas before, a lot of the UK population rightfully felt that it's my right and privilege to have the NHS and I'm going to use the NHS, and that's fine.
Is there any big barrier that's a real problem now at the moment? Because you get so many headlines, right? The NHS is sinking, it's all these problems.
I think better communication between all the healthcare professionals and, having that one thing that we're all here for the care of a patient, to optimize their care. So, sometimes I think to think about not doing the treatment, but doing the preventative medicine. So that might be a better way to go through it. So rather than saying he's got diabetes, we'll treat it, but to try and prevent that diabetes. So instead of saying, okay, he's got diabetes, we know there are markers to say that he's going to be pre-diabetic. So maybe look at those markers and say, okay, NHS clocks in and says, stop him having diabetes. Let's help him to stop that. So it's becoming more healthcare, more education for the patient to say that, change your lifestyle, do more exercise, eat healthier. Maybe that way would be better.
The jewel in the crown for the NHS could be the preventative piece. It could be. But in direct answer to your question, I think that the more we empower patients to take more responsibility and ownership and foresight into some of the problems that they see within themselves or their community, I think that that's where there'll be a change. So is there enough money in the system to make that happen? It's difficult to say. Is there a role for people seeking, proactive, preventative things in the private space? Yes. I mean, if someone's going to do that, and I think that it's evidence-based and justified, I think that's money well spent if they can afford to do it. And if they can't afford to do it, they shouldn't be penalised to say you can't afford to do it, therefore you can't have. So I think there is a balance to be had.
The future of medicine is being built right now. It's just being built outside the public system. To my mind, there's a deliberate phrase which I can use to describe this shift. It's not deliberate privatisation. It's not shifting policy. It's something more pernicious, actually. I think the word or the phrase is privatisation by exhaustion. The public system has simply become too stretched to deliver the preventative care that the people of the United Kingdom require in 2026. So the country is quietly splitting into 2 health systems. and yet no one is really acknowledging this. The NHS will exist as it was initially designed for acute solutions, emergency, free, universal, and still world-class. It still and will work beautifully for the diseases it was designed to solve. The second is being built privately. Longevity clinics, functional medicine, diagnostics, preventative, personalized, and continuous. But the reality is this will only be available to the people that can actually afford it. The reality when you look at it is health is actually upstream of almost everything positive in life. Energy, productivity, possibility to earn, mood, family stability. There is actually no greater form of inequality than health inequality. And I think it's a sad and dangerous thing if the future of health in this country is going to be divided along the lines of wealth. Fast forward a few decades, and inequality in health will mean inequality in everything else. And that will compound over decades. So what do we do about this somewhat challenging hypothesis of a future? Honestly, I don't know. I don't have the complete answer. What I'm building and what I'm going to be telling you more about is a preventative health solution in the longevity space that sits in the era of new medicine, the one that tries to catch disease before it forms. I think the challenge for all of us moving forward that work in this space is how to close the gap between these two healthcare systems that are going to grow in the next few decades. How to build access in this new preventative healthcare system to people not only who can afford it, but hopefully eventually to everyone, in the same way that the NHS initially promised. One thing that I'm quite excited about is AI. Perhaps in the future, artificial intelligence can democratize preventative medicine, functional medicine, in the same way that the NHS democratized acute medicine when it was incorporated in the 1940s. The truth is the NHS is not failing. The disease landscape has changed. We're asking the NHS of today to do more than we asked of the NHS when it was first incorporated. Whether we like it or not, the next model of healthcare in this country is already being built. The only question now is who gets it first and what we decide to do about the question of who is left behind by this model.